Everyone, welcome back to the podcast. Welcome all new listeners, and welcome back to those who've heard my content in the past. If you want to know how to use storytelling to get athlete buy-in with your plans of care, you need to tune into this episode. Before I go on to the podcast, what is new with life? What's better? I'm on I'm going to be away with my family. I'm going away for a couple days just to recoup, relax, spend some time. Those who follow my podcast for the last couple years, I enjoy this. This is everything that I do. I think we do it once a month, maybe every other month, at least once a quarter. This one's a 2-day event or 2-day getaway at a local resort. So I'm really excited about that. Be in the pool, drinking some margaritas and enjoying some time with my wife and just talking about life. That's like, gosh, it's my favorite thing on the planet. But yeah, other than that, kids are doing amazing. They're on break. For those of you who don't live in California, something called fall break. It is where it's kind of like spring break. It's just interjected into the fall, and it's some schools out in California do that, so it's a good time to have them home. But they imagine having 3 kids at home at the same time. That's what we're doing. All right, onto this podcast. What are we talking about? Storytelling. It comes from the struggle that I see physical therapists, how hard it is to watch physical therapists sometimes describe a plan of care. It's like cringeworthy sometimes. And you see a person, a brand new patient, and you're trying to describe what their problem is, and you're trying to describe it in a way that they understand, and it comes out very robotic. It comes out like a medical professional, and that patient or athlete is super lost. It's very cringeworthy, and it sounds something like, well, based on your impairments and all the knee valgus and hip abduction and pelvic port control, it looks like you're putting excessive pressure on the rear portion of your talus, and that's what's causing you lateral ankle and knee pain, which is increasing force all the way through your anterior hip and creating low back pain. And that's why you have pain, Mrs. Jones. And when you think about that, the patient understands zero of that, right? As a clinician, you've gone to school for many years to understand these things. And the problem is that the patient or the athlete doesn't necessarily understand any of that jargon. And I want to share an easy way to get the message across. And I'm coming from the patient's perspective, from the athlete's perspective. As I've practiced over years, there's some easy ways that you can offer the same information at a very basic level, and that includes a technique called storytelling. And storytelling is a very easy way for individuals of all ages to be able to understand everything that you're talking about. And the better you can get, at this is the more buy-in you can get from any of the patients and athletes that you have. And yes, I said buy-in because buy-in is so critical. It's everything on if that person feels like they're going to get better and they understand that course of care, they're more involved, they're more likely to do the things and be compliant. And now what sets you up for better outcomes. So in this episode, I want to give you the framework to storytelling and how I've done it with tens of thousands of patients and athletes, and how I do it with my staff, how I do it in presentations. I've spoken at, I think the largest presentation I've ever done is 10 to 15,000 people, and all using storytelling. And I'll share one right off the bat. This was in 2005. I was 23 at the time. And I was graduating from undergrad, and it was a very like big part of my life to have this moment. And this was, I think, 10 to 15,000 people in front. And I earned the opportunity. I think I ended up finishing undergrad with a 4.0, and I got recognized by our department. And it was everything to me to try and, because if those of you know, I wasn't very successful in high school, and was illiterate and all these other things. And it was very big for me. It was a big fear. It was a big doubt I had to conquer, was to show the planet that I can do something. And so I taught myself how to read and write. And somehow along the way, I got a 4.0. And as I got recognized, they asked me to speak at the graduation ceremony to give the opening speech. And while there was 10 to 15,000 people, one of the most important things to me was to have my grandmother be in the audience. And for those of you who know, I was born and raised by my grandma. And even though there was 15,000 people, there was one person, it was like a spotlight on her, and I can see her. And during the speech, I was talking, and I brought her up, and I looked over, and all I could see is my grandma just bawling, her hands over her eyes. It was not that the fact that I was getting an award, is that I recognized her at that event. Like the emotion she felt was like everything that she had done her whole life to get me to a certain point mattered, like right there and then, that she was recognized, that people knew what that meant for her. It was not necessarily the accolades. Yeah, it was important for me to graduate and do these things, but she really, for her, was to understand that she felt like she was doing the right thing, and she did that. And when I recognized her, it meant everything in the world to her. And telling these stories and helping people understand how you feel and what gets you to a certain point, and how this is going to help them, it helps people identify that, because they can see themselves in that. Even you right now, wherever you are accomplished, whatever your story is, you can see yourselves in that, in your parents, and your brothers and sisters, or your best friend, your spouse, whatever it is. Like, you have that same emotion that you can do. Now, the question is, I just shared a story, and the question is, how does this help inside your clinical practice, and what are the strategies? Well, storytelling was introduced to me back in college and in PT school, and I love the concept. I love speaking to people, and if you don't love doing big large events or workshops or big presentations, what you have to realize is you are a public speaker every single day, and you do it in an audience of 6 to 15 people to 22 people a day. And it's just a smaller scale, but you are presenting something. And I think you need to know that, yeah, you're a clinician, absolutely, but at some point you're presenting something. And this is particularly true with initial valuations, in that what is a presentation? A presentation is providing a setting with people in it, and then you have conflict, and then you have like a resolution. And that's really what's happening on an initial valuation, in that you have the setting, which is this person's coming in, they're telling you the story of how they got hurt. And then you identify, like, okay, I understand this is what's happened. Now let's figure out what happened to you that led to that. Oh, it looks like you have poor knee mechanics, or poor shoulder mechanics, or scapulohumeral rhythm, and poor posture. And all those things combined with everything that happened in life led you to this. Now, here's the great news. Now we talked about, and that's the conflict, that's the setting. Now we're talking about the relation. The great news is that you found me, and now I can help you get out of this. What we're going to do, here's the resolution, is we're going to, for the next 3 weeks, work on activation and strength, so we can improve your posture, put you in a better position. The next 3 weeks after that, we're going to work on your running form, or your posture, and all those other things. And then after that, we're going to bulletproof your shoulders and your hips and everything else, so it doesn't come back. So in the next 8 to 9 weeks, that's what to expect. And that's the story. You have the setting, you have the conflict and issue, and then you have the resolution. And the problem becomes is if you don't lay that out properly to the patient or athlete, they don't understand it. And what happens, you ever read a really bad book? You read the first intro, like, chapter, and you read that story, that chapter, and you're like, this is horrible. What do? You close the book, right? Most of us. Or you bought the book and you forced yourself through it and you hate it. Like, that's not an enjoyable experience. So that's what happens when patients or athletes come see you. That first initial evaluation is the first chapter. So they're coming in to read that first intro chapter. Let me see what this person can do for me. Now they're skeptical. Every person that comes to see you, you have to realize they're skeptical. Why? Because you're taking time and money away from them. And in order to earn money and time away from people, there has to be value in what you do, what you bring to them. So if the person says, hey, I have to take time off work during my lunch hour, now I have to use my, sick time or vacation time, whatever it is, I have to take 2 hours to come see you. This better be good. And so all you're doing, instead of putting pressure on yourself, is you're just explaining a story and how you're going to be part of that story. It was one of the best, easiest ways that people described what I did for them. It was a mentor of mine who brought this on to me, and they said, ultimately you're their lives are changing, and you're just one chapter of their entire book. That's all you're doing. And if you can understand and show them how you fit inside their chapters, inside their books, they understand, oh, I didn't know that. I didn't know that you were going to be doing these. They just don't understand, so they're super skeptical. They're worried, and they're concerned about the value that they're about to get. So the best thing you can do is offer this form of storytelling, and I'm going to outline that for you. But let me describe what happens if you don't storytell properly. And I'm going to go step by step. So I have some notes here. So has this ever happened to you? You have a patient or an athlete who, gosh, they just don't seem compliant. They don't listen to you. They don't do the exercises. They come in 10 minutes late. They didn't really conquer anything. They didn't accomplish anything, and they have poor outcomes that session. Nothing's really changed over the next 3 to 4 visits. And you're like, you know what? Let's just discharge them, right? Or even worse, they self-discharge. So you have non-compliance at first. I'm not really into it, which means they don't see value in what you're doing. And the next one is they discharge themselves, because truly that's when you know you've already reached that milestone. It's already too late. You didn't have value on the initial evaluation. You didn't have value at session 2, 7, 8, 12, 15, whatever that is. So you get self-discharge and they're out. Well, that's typically because they didn't achieve the outcome they wanted. And if that's the case, what happens? They self-discharge. What happens to the PT? You have an empty schedule, right? Now you got to fill that. And whether you work in any industry, whether it's insurance-based, cash-based, pro setting, college sports, whatever it is, if you're a go-getter and you love what you do, you don't like an empty schedule. Yeah, you need a break every once in a while. I get that. But at the deep root level, you didn't come into this profession so you can have an empty schedule. Like if you want to work and just get in, get out, you wouldn't be listening to the podcast. You wouldn't try in self-development. You wouldn't be doing those things. So if you look at an empty schedule and you're excited, you're in it for the wrong reason. Yeah, you occasionally need breaks, but nobody here listening to this is excited about, open blocks, right? You're twiddling your thumbs. Yeah, you can document, but I'd rather be interacting with people. So you have non-compliance, you have self-discharge, you've got poor outcomes, you got an empty schedule. Now, when an empty schedule happens, this creates, now you have to question yourself. You're like, oh, well, gosh, am I a good PT? Like, is it me? Is it them? No, it's just a bad batch of patients, just really bad batch for the last 3 months, really bad batches. Yeah, everyone else's schedules are full. And you're like, wait a minute. Then that creates self-doubt. And when you have self-doubt and you continue to have those open slots, non-compliance, self-discharge, poor outcomes, empty schedules, you have a self-doubt. And now you're like, well, maybe I don't love this anymore. Maybe I don't enjoy working anymore. Now you have poor job satisfaction. Now you consider other jobs or other opportunities. Maybe it's this workplace. Yeah, maybe it's my coworkers. It's a bad patients. Before you start doing all those things, and you have to go down that full list: non-compliance, self-discharge, poor outcomes, empty schedule, self-doubt, poor job satisfaction. There's some small tweaks you can make to your initial evaluation that it would help reduce a lot of this. So it sets you up. Think about this. One small step at the very beginning of initial evaluation helps buy-in. Buy-in is the thing that helps you realize this person has value and you're going to help them. And once you can have buy-in, it sets the stage for everything else. But if you don't have buy-in, everything else cascades down to non-compliance, self-discharge, poor outcomes, empty schedule, self-doubt, poor job satisfaction. If you don't want to go down the rabbit hole of poor job satisfaction, self-doubt, looking for employment somewhere else, empty schedule, poor outcomes, self-discharge, storytelling is one of the best things you can do at the start to have patient or athlete buy-in, because it sets the cascade of events. So now that we talked about, storytelling and everything else, let me show you how this works. And I've done it inside this podcast already. Ultimately, there's 3 steps to storytelling, and you are storytelling within a chapter of their book. That's all you're doing. Okay. This is their life, and you happen to be within a couple pages of a chapter, I don't know, 25 of their life, or chapter 30 if they're 30 years old, or 50 if they're 50 years old. So now you have to put it in context of how this fits within their life. So 3 steps. Ready? Why, what, and how. So the first step is the why, right? Always stay on the why. And this has to do with the settings and the characters. Step 1, determine the setting and the characters. This is them, right? So now you're interviewing him. Let me have an understanding, Mrs. Jones, on how this developed. Tell me what happened. What led up to this whole problem, right? Now, that's the first step. You're trying to figure out the setting and all the characters involved, because it could have been, they were at the workplace, they were with their friends, whatever. Tell me about it. Tell me about the story. Well, I was jogging. I was doing trail jogging, and I was going up these mountains, and I tripped on a stick and fell down onto my kneecap, and that's why I ended up having issues. And ever since then, it hasn't gone away. Great. So since then, what happened from that time? That was 3 weeks ago. What happened? Well, I continued working out, and I took ibuprofen. Did you see anybody about it? No, didn't see anybody. When did you see your doctor? About 3 weeks, 2.5 weeks into it. Okay, great. Did you do any exercise actually, I did. I YouTubed everything, and I tried doing some exercise on my own, and that didn't work. Did you apply ice or anything else? Yeah, I tried ice. That didn't work. What about a brace or anything else that you have to apply on it? Well, I put some Tiger Balm on it. Sounds good. Now, what you did there is you understood the setting and the characters. You have to get a good sense of what has happened, what's led up to now, who's involved in this whole thing. So the question becomes, you now know why this is so important to them. And so you figured out at some point that what took you so long to get in here, or why didn't you just do self-treatment by yourself? That answer tells you so much. Well, I YouTubed everything and that didn't work. Okay, great. So you tried everything on your own and you weren't able to get the outcomes you want. So by yourself, you can't get you can't get these outcomes. And that's why you need me. Got it. That's step number 1. Got it. You don't want surgery? No, I don't want surgery. So they want non-operative approach, and they don't know how to do it by themselves. And that's why they need me. Got it. That's the setting and the characters. The question is, what's the problem? What's the conflict? What is the current problem that they want addressed? And that's, well, I don't know how to do this on my own. And now I can't go up and downstairs by myself. I can't play with my kids. I can't run. And that's the thing that makes me happy. Got it. So you need me because you've tried it on your own and you don't want surgery. You need me non-operatively to help resolve your pain so you can get back to running, so you can enjoy life again and play with your kids. Got it. Yes. Now it's step number 3. So step number 1 was why. Determine the setting and the characters. Number 2, describe what. And that's the conflict. What is the problem here? Number 3 is, how are we going to fix all this, which is the resolution. So next you list step by step on how you're going to get out of this hole. So let me understand this, Mrs. Jones. For the last 3 weeks, you've suffered from knee pain from a traumatic fall while hiking on trails. Yes, it's currently limiting your ability to play with your kids, go up and down stairs, and run. And you've tried self-treatment, you don't want surgery, and you need my help to fix all of these things. Yes, got it. Well, the great news is we've looked at all of your things, all of your impairments, all of your posture and everything else. And the good news is you only need to work on 3 things: the hip mobility, your core work, and your ankle flexibility. Those 3 things are easily fixed and addressed, and they typically take around 6 to 8 weeks to clear up. I'm very confident we can get you out of pain with your daily life in 4 weeks, and then get you back to running within 8 weeks. That combined together puts us in a really good scenario, Mrs. Jones. How does that sound to you? And you're like, well, that makes sense. You went through their chapters. What happened in the past that led you up to now? Great. What does ideal look like for you? And what does not ideal look like for you? Well, ideal looks like non-operatively managing this here because I couldn't figure it out on my own. Not ideal is I don't want surgery. Sounds good. What's the resolution? I can easily conquer this. And here's the steps that I'm going to do that. Based on all these things, I can get you there in 8 weeks, pain-free and running. And here's the goals I'm going to set up for you. Here's the outline. What questions do you have about that, Mrs. Jones? That's perfect. Now, I just told you a story about somebody who tripped and fell, have discussed their fears, and easily resolved it all within a 3-minute description. Now, on an initial evaluation, let me tell you what PTs sound like. Ready? Mrs. Jones, you've had pain for 3 weeks. On a scale of 9 to 10, your patellar mobility is poor. You have poor single leg balance, and you have weak hip muscles. You have tried things on your own that didn't work. What we're going to do is improve your knee mechanics, work on your hamstring flexibility, and improve your ankle strength. The doctor gave you 8 visits, so we'll work on the ankle and hip at first, then we'll work on your hamstrings, and then by the 7th or 8th visit, we'll finish off with return to run. And that's all going to be outlined in this program here. Here you go. Now, the difference between the storytelling approach and the impairment-based blah, blah, blah approach is all you did in the blah, blah, blah approach is list exactly what they knew and all their problems. That's a problem-based approach, right? Here's your problems. Great. And here's a paper that's going to solve that. What you didn't do is outline how this impacts them and how their life is going to look afterwards. That's the ability to storytell. So on a problem-based approach, you're likely to lose them. You're likely to be like, well, can't any other PT do that and just give me exercises? What's the difference between you and anybody else? What you didn't do was put it in context of how this impacts their life and what that future holds. And people can identify this with stories. Great. Look at like here's everything that's happened. That's their storyline, everything coming in. And the great news is, imagine 8 weeks from now, running again, playing with your kids. And here's the challenges that we have. Here's the great solutions, step by step, every single week. Let me just tell you the whole story. And when you present people to these type of approach, there's a couple things I want you to consider. Number one, they're all the same thing, but I'm going to say it in different contexts. Number one, I want you to use 6th grade terminology, meaning a 6th grader can understand this, meaning your grandparents can understand this, a 6th grader can understand this. So if you're saying knee valgus and you're saying anterior glides and posterior, people understand that. Please don't do that. Take all that vernacular out of your brain. Make it so simple that my 7-year-old son or a 6th grader can understand. Oh, I see. Every time you go down, your knee goes in, and that's what's causing you more and more pain or stress inside that. So we're going to pause. And I literally, if you can like speak at a 6th grade level, everybody will understand you. The second approach to this is, can you speak in Mandarin? Can you speak in French? Can you speak in Spanish? Can you speak in German? So simple that somebody who doesn't understand fluently can get exactly what you're saying. Can you make it so basic? Less than 15 seconds. Describe their storyline on how you're going to help them. Can you speak in a foreign language? Can you speak at a 6th grade level and make it so simple in less than 15 seconds? And if you can't do that, that's what leads to poor outcomes, self-discharge, empty schedules, self-doubt, poor job satisfaction. You never even gave your skills a chance because they couldn't see the storyline happening in their life. And if you can storytell, determine the setting and the characters, discuss and identify the conflict, and provide the solutions in any form of things that you do, whether it's my son, and I'm talking about Zach inside his class. Right now, he's trying to figure out how to read better. His teacher is telling me he needs to be more proficient in reading. Got it. That's the setting of the character. What's the conflict? He won't read at school and he needs to pick it up. Got it. What's the solution? Nighttime reading for him. Oh, got it. But that doesn't put it in context. Or he will struggle in 2nd grade and have a hard time amongst his peers. That to me is more powerful because I'm like, oh, now I know what the negative or the fear is because now I know where that sets him back. So if you can put people's lives in context and tell a story and I help them identify and see where your brain is, take the PT vernacular out, completely remove it, It's because you communicate with physicians and insurance companies and fellow coworkers that you speak like that. But the minute you go home and you talk to a spouse, you completely switch. Why does that happen? The same way you talk to your spouse, your partner, your family is the same way you should be talking to your patients. So if your family says, "Hey, why does my knee hurt?" You would imagine you would use that approach. Now, if you have a 11-year-old ask you, "Hey, my shoulder's been hurting. Why is that?" I'm sure you talk to an 11-year-old differently than a 40-year-old. Yet you should be applying this 11-year-old process to the 40-year-old. Why? Because it's going to help with buy-in. The minute that somebody understands the context and they see the value, they buy into that. Don't complicate this. Use storytelling inside your sessions to help maximize your outcomes and ultimately improve your job satisfaction. That's what it comes down to. You help more people and you enjoy going to work. Those two things alone, just by doing one simple thing and not more taping, not more mobilizing, you have to earn that right. And most of the time, if you've done a poor job in the initial evaluation, you'll never earn the ability to use the skills that you have invested thousands and hundreds of thousands of dollars on. Think about how many courses, graduate school, all these other things to develop the skills. But if you never get to use them, what are they worth? So you have to buy that opportunity to do that. And that's that buy-in on the initial evaluation. So there you have it. I want you guys to improve your outcomes through storytelling. It's an easy strategy that I've used with all forms of athletes. And the fun fact is a lot of barbell athletes, the CrossFitters, love these things because their movements are so complex. And the minute that you can break them down to simplicity, that I need this bar to go vertically. I don't want you coming past it. I want your head going forward. If you do, you're going to hit your head or you're wasting more energy. Think of it like your feet are leaving the ground or you're pushing your feet into the ground as high as possible. Putting internal and external cues to help them understand the story on how that gets them to the platform. It gets them to understand complex movements provided in a simple process. That's the type of people that enjoy that. So wherever you are inside your clinical practice, use this. Use the framework. It'll help you tremendously. It gives you an opportunity to have a better chance at the buy-in, to be able to use the skills that you've always looked for. So there you have it. There's something to give you some things to focus on for the week, for the month, inside your clinical practice. And for those of you looking to advance inside working with barbell athletes and patients and athletes who do complex movements, and you're looking to simplify that, join me at my upcoming Management of the Barbell Athlete course. That is in 2023, whenever you're listening. It's October 28th and 29th, virtually and in person. So I hope to see you there. If not, I will see you guys on the next podcast. Take care.